Okay, welcome to the very first episode of Empower Indie podcast. We're really glad you're here. This podcast is a space for honest conversations about health, well-being, and community resources, all with the goal of helping people in southwestern North Dakota live happy, healthy lives. The Empower Indie podcast is hosted by Women Empowering Women, a membership-based nonprofit organization dedicated to connecting, supporting, and educating women. Through community events and resources, Women Empowering Women helps women grow, build confidence, and explore their potential, supporting them in every step of the way as they become the best version of themselves. To learn more about Women Empowering Women's projects or how to become a member, visit wewnetwork.org. For our first episode, we're starting with a topic that affects many people but is still often misunderstood: STI and HIV testing. For some, the idea of getting tested can bring up fear or nerves, especially in smaller or rural communities where privacy matters. Today, we're here to help change that. We'll talk about why STI and HIV testing matters, how often people should get tested, and what the process actually looks like, how confidential and easy testing really is. Joining me today are Rachel and Chelsea from Connect Medical. Welcome to Empower Indie Podcast. Let's get started.
All right, thanks for having us.
Yeah.
Excited to be here.
Okay, so before we dive into the topic, I'd love for our listeners to get to know you a little bit better. So can each of you introduce yourselves and your roles at Connect Medical?
I'm Rachel Marshall. I'm the nurse practitioner at Connect. I've been working there about 4 years.
And I'm Chelsea Crone. I'm the director of nursing at Connect, and I've also been there for 4 years.
Okay, so when people hear the words STI or HIV testing, what reactions do you commonly see?
Yeah, so we do a lot of education out in the schools. And so when we talk about STIs, there's a lot of heads down, not a lot of eye contact, just probably a little more embarrassing, uncomfortable topic, not for us. But and then when people come into the clinic, they are definitely nervous, probably the fear of the unknown.
Mm-hmm.
And on the phone, they are also seem to be a little more uncomfortable, just calling for, testing is kind of how they word it. So, yeah, just really uncomfortable, I would say, for most. But
I would agree. And we're excited to be here just to really make that what is uncomfortable for most less uncomfortable, we hope.
Yeah, okay. So do you feel like because we're in Dickinson, and it's a small community, does that make it harder for people to reach out and get care?
Yeah, I would say so. We're in a smaller community that everyone knows everyone. I think people we see are fearful of that, somebody might see them parked in front of a clinic, see them walking in, and maybe are going to be even cared for by somebody they know as well. We definitely hope that that's not a barrier to, somebody receiving care, especially with us at our clinic, whether it be for STI testing or anything else. And that we, abide by all HIPAA privacy practices and would want, anybody that we're in front of to feel like it's confidential and safe and they can really be open and honest.
So one of the questions that I know that other people have had as well is, do you guys serve men and women?
we do. We see probably more women, but we definitely see both men and women.
Okay. So one of the common questions that people have is, how often should I get tested? Is there annual STI or HIV testing that's a good rule of thumb for most people?
Great question. And really something that most people, I would say, don't know. But the recommendations would be annual testing for anybody or before any new sexual relationships should really have testing, both the person and their partner.
How does having a new partner or multiple partners affect testing frequency?
Yeah, so really before you get in any relationship, talking about that, like Chelsea said, and just both getting tested. If there's multiple partners, it's recommended to have testing before any new partner.
With a greater amount of partners as well, just knowing that that's an increase for a risk, right, to contract an STI. And so really just being open with your partner, having those conversations, and just being sure to have that testing.
Is there any situation that they should get tested more urgently, Or, if they've just got tested and then is there a situation that would make it so that they do need to get tested again urgently?
For, anybody who has unprotected sex with like a new partner, if they were using protection and the condom broke, that would be, something to also get tested for. If their partner would be positive for an STI, that would definitely warrant for testing. I would say a sexual assault case as well to be immediate testing. And then if their partner has like a known HIV, what's the word? Infection, yeah.
Yeah. Or, perhaps if they were experiencing symptoms, symptoms don't always appear right away, but, if somebody was experiencing symptoms, sores, anything that had come up that would.
A lot of STIs, people think that, I would have something or it, show symptoms, but really they are asymptomatic a lot of times, meaning they show no symptoms. So best would be is to, just get tested so you know.
And then when that happens, are there repercussions if they don't get tested or they go untreated?
Yeah, definitely. So a lot of STIs can go quite a period of time without, symptoms showing. The longer somebody goes without having that testing and then having that treatment, or even multiple, recurrence of these STI infections, can really cause damage to the reproductive system for both females and males, but females do bear a greater risk.
Females bear the greater risk just due to the surface area, more mucosa in the vagina, so than men. So that's why. And then also their cervix is more immature. There's just layers that need to build up over the years until about the age of 25. And then those gives you better protection.
So testing's completely routine, but it's natural for people to feel nervous. What are the most common fears you hear, and how do you help people to get over those fears and feel comfortable?
Yeah, I think really, like Rachel had spoke to before, the fear of the unknown, like what to expect. How are they going to test? What are they going to ask? Just kind of what does an appointment look like? And we really like to walk somebody through their entire appointment, no matter what they're being seen for, just to give them all the information so they can consent, obviously, to what will be, talked through and performed that day. We can share a little bit more later with what testing looks like and all of that.
Okay, so we're going to play a little game. It's a myth or fact game. So I have some paddles for you. And then for the audio only, we'll also say it out loud so that you can hear it. So I'll say what the myth or fact is, and then you guys tell me what it is and kind of give me a little bit of background if you can. So you can get an STI the first time you have sex.
Fact. Doesn't mean, just having sex one time, you can get an STI regardless.
Yeah. Any sexual encounter, there's a risk for that.
Okay, the next one. Women are more likely to get an STI than men.
Fact. And that goes into kind of what I spoke upon as far as just more mucosa and surface area. STIs really like to be in dark, warm places. That's where they really harvest. And then as well as the immature cervix.
Mm-hmm.
Okay, so using 2 condoms at once is safer than 1.
Myth.
Definitely only use of 1 condom. Just improper fit, especially if there were to be 2. Also, like friction rubbing could increase the risk for tearing.
Okay, you can contract an STI from toilet seats or swimming pools.
Myth. The bacteria, viruses, they just don't live on surfaces for as long for you to be able to contract.
Okay. STI testing is only needed if you feel symptoms.
Myth.
You can get the same STI more than once.
Fact.
It's common for chlamydia, gonorrhea, and trichomoniasis.
Okay, STI symptoms only show up within days.
Myth.
STIs can be treated with over-the-counter medicine.
Myth. Especially bacterial infections, those do need to be treated with antibiotics, prescribed antibiotics.
It's important to take them exactly as prescribed. Make sure you finish your
Full course.
prescription. Yes.
And your partner would need to be treated as well.
And abstaining from any sexual activity during that time while you and your partner are being treated.
Okay. STI testing is confidential and private.
Fact.
Always should be.
Okay. So when, we're walking through trying to break the stigma for these patients and getting them in the clinic doors, let's walk through what actually happens when a patient comes in for testing and what it costs. So first, do patients need appointments or can they walk in?
Great question. We love to try to prioritize as much as possible walk-in appointments at Connect. It's not always available same day, but we would be sure to get them scheduled, as soon as we're able to do so. But really just talk to them about what their greatest needs are, what their concerns are, and get them booked as soon as we'd be able to see them.
Okay, and then during an STI and HIV testing appointment, what does the testing look like when for the different infections that they could have been exposed to? Do you explain, or could you explain what that would look like?
Yeah. So a full panel for, HIV testing. For STI testing, HIV testing is included in that. We do in our clinic rapid HIV and hepatitis C testing. That's done by a finger poke, and results are given same day to patients, which is wonderful. We also will do a syphilis testing, which is done through a blood draw, and we send that sample off. And then chlamydia and gonorrhea testing, and that is done from swabs, and we swab at the site of exposure. Those are also sent off for testing, and then we call a patient with results within a few days up to a week's time, just kind of depending on if it's getting close to the weekend and sending out to the lab and whatnot. And then for women, we always do a pregnancy test as well, just to be sure if there was a positive pregnancy and a positive STI, we would perhaps change the course of medication.
Yep. And then urine testing for men for gonorrhea, chlamydia instead of the swabs. But we do oropharyngeal, just kind of where they were exposed, as well as like a rectal swab.
And then we do, for women, testing for bacterial vaginosis and trichomoniasis as well, and those are via vaginal swab, and those are rapid results that we can give in the clinic same day.
And patients are welcome to collect those swabs in the privacy of the bathroom, as well as the urine samples, or provider can also collect those as well if they're more comfortable with that.
We just kind of try to get to know their situation, asking them some questions, perhaps when their last date of exposure was. As we know with the incubation period and the time where, symptoms may not have set in, it could also be just better for them to test, closer to the end of that incubation window. We don't want to test too early and get that false negative result as well. Sometimes that can be comforting for someone to hear that it's okay to wait a couple weeks and we're going to get you in, we're going to get you seen. But we'll try to give them the rundown of kind of what to expect for that first appointment and maybe calm any nerves until that time. And then just always be sure to let them know to give us a call if they have needs in between. If something comes up, if they're concerned about something, just always call. We'd rather somebody call with a question than worry.
Are those things usually covered by insurance?
Yes, they're definitely covered by insurance. For those who do not have insurance, though, we do have a sliding scale. So it can be very affordable. So the sliding scale does go over, house income and then how many people live in your house. And it does, like I said, a very generous sliding scale, so very affordable.
If they weren't insured, looking at helping them get set up with services for Medicaid, we can help navigate them with enrollment for those services and talking to social services about what other programs they might have.
Okay, and then for anyone listening who's thinking, I should probably get tested, here's how to take the next step. So for listeners, can you, at Connect Medical Clinic, just kind of give us some information on how they would contact you?
Yeah.
To be able to get in?
Definitely. So they could call us, give us a call over the phone. They can find us on our website as well, connectmedicalclinic.com. And then we also have a text line too. So if they go to our website, they can see our contact information that includes our phone number and also our text line.
Okay, well, thank you guys, Connect Medical Clinic, for sharing your time and expertise today. And thank you, listeners, for joining us on our first episode of Empower ND podcast. This episode was made possible by an STD prevention and control grant through the North Dakota Department of Health and Human Services. Stay informed, stay empowered, and we'll see you next time on the Empower Indy podcast.